So importance of a comprehensive diagnosis and a treatment planning, especially when it comes to full mouth implant rehabilitation, is what that we were seeing in our previous video. So this video is going to be a continuation of that video. If you have not seen our previous video, kindly please watch it so that you will have a context of what we are speaking right now. This is Dr. Arun from Pearls Dentistry, running dental centers at Chennai, Raja Annamalipuram since the year 2001. If you have not subscribed to our channel, please do subscribe to our channel Pearls Dentistry. We've got a whole bunch of videos coming out on dental health and awareness. So now, so that's the X-ray that we were discussing it in our previous video. We had just a brief recap. If you have not seen the video, we had a patient coming in and asking for replacement of just a few teeth in the posterior region. But when we looked at the X-ray, we had a complete loss of bone on most of his upper teeth. It's only 20-30% of bone left. So it was decided that it's better that we plan for a full upper arch reconstruction is what that we had actually planned. So when we took a CT scan, the importance of CT scan is manifold. So one is, of course, it will help us to evaluate his bone and his teeth present in the bone. We can look at any infection that is there, any issues with the bone. We can measure the bone in terms of the quantity of bone, what is the length of bone available, what is the width of bone available. We can measure the bone in terms of quality, and so it gives us a very real-time useful information about the condition of the patient's jaw, teeth that is present. That's one. Two is, it helps us when its implant is a surgical process, right? So when it comes to implant industry, there is a lot of anatomical structures in our jaw which are limiting structures. So for example, we have the mandibular nerve, we have got the maxillary sinus. So we need to choose the ideal implant for the ideal site, and in that ideal site, what is the amount of bone that is available. So CBCT not only helps us to find out what is the present condition, what is the disease that are there, but it also helps us to plan the future treatment of how we can actually plant the implants. So if you look at this particular, this is a slice from the CT scan. Of course, we can always insert the video of the CT scan for this particular patient. Here we are looking at, after extracting all these teeth, what will be the potential areas in which we can place that implant. So in those potential areas, how many implants are we going to place? What is the length of the implant? What is the bone that is there? So we can plan the entire thing. So even before the actual surgery is carried out, we are doing a virtual implant treatment planning for this particular patient. So once this is done, what we do is we can transfer all the details that we have done for the surgery by forming what is called a surgical guide. We can actually do this virtual, so whatever is planned virtually will get reproduced during the actual surgical treatment phase also. So that's what it happens when we plan a surgical guide for this particular case scenario. And because it's multiple process, like it involves extraction of quite a number of teeth and then implant placement, we do this entire process under sedation. Sedation simply means a sleep dentistry. It's also called conscious sedation, where we have an anesthetist coming in, give you a small sleeping dose. The patient sleeps on the dental chair. So most of the dental procedures, there is a lot of anxiety associated with many dental procedures. So when you want to do a lot of dental procedures and patient is also anxious, the sedation dentistry or sleep dentistry helps us to remove the anxiety of the patient. So we will be able to extract all the teeth, also place the implant in the same visit. So that's what that was done for this particular patient. So we have extracted all the teeth using a surgical guide, place all the implants, and then the next phase of restoration of those implants starts. About the restoration, we will be looking into the next video. Hope you like this video. If there are any questions, please do ask in the comment section below. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.